what are some of the most common psychiatric symptoms you see in Lyme patients, and are they typically mistaken for other mental health conditions?
That's a good question. So, I'm a psychiatrist by training. I'm a child psychiatrist also, which means I see adults, but I also see a lot of kids. And I can tell you, I've seriously seen the entire gamut of psychiatric symptoms related to these infections. And I probably wouldn't believe it if I wasn't a doctor who saw it every single day in my practice. But I would say the most common symptoms that we see in the adult population would probably be anxiety, depression. On occasion, I also see adults that present with psychosis related to either Lyme disease or, in particular, Bartonella infection, which is another infection you can get from ticks, but you can get it a lot of other ways. Like you can get it from cat scratches, you can get it from ticks, like I said, lice, fleas, house spiders, sand flies, and probably biting flies too. So Bartonella is kind of scary in the sense that it can also cause these psychiatric symptoms like Lyme disease, but there's just a lot of different vectors in which you can get Bartonella. So that is sort of the adult population, I would say, predominantly like sometimes very severe anxiety, depression, and sometimes suicidal thoughts along with anxiety and depression, and then sometimes psychosis. From a kid's standpoint, when they get these infections, one of the interesting things is that usually when adults get infections like Lyme disease, we see other more medical symptoms coming along with them. Not always, but usually we'll see other symptoms like fatigue, joint pain, problems thinking, and the psychiatric symptoms. By the way, we also can see in general mood disturbances. So, for example, bipolar disorder, symptoms of mania, depression in the adult population too. The point I was going to make with adults is that usually we see joint pain, fatigue, those kinds of things along with the psychiatric symptoms. But for kids, oftentimes they will present only with the psychiatric symptoms. So that's even scarier because somebody who presents only with psychiatric symptoms, if you don't go to a doctor who understands the link between infections and psychiatric symptoms, it's easy to miss, basically.